to you by Batteries Plus.
Well, there could soon be 3 brand new weapons in the weight loss arsenal.
Yep, 3 new drugs. That's what the FDA is considering this week. And Fox 13's Dr. Joe's here with what they could do and who might benefit most. Joe?
Well, Cynthia and Mark, for some of you, diet and exercise just aren't enough. But now, for the first time in about a decade, the FDA will evaluate whether a handful of new medicines will help you lose weight. Reversing the trend of obesity often means reversing years of high-calorie couch potato lifestyles.
No magic pill, I wish.
Weight loss specialist Dr. Karon LoCicero says medications can help suppress appetite, like phentermine, a drug that's been around for decades.
It has been effective, but I find that when patients come off the phentermine, there's a tendency to gain weight. And I also find potential side effects with elevated blood pressure. Insomnia is another concern.
Now a new drug, Qnexa, combines phentermine with another anti-seizure drug also used to treat migraines. It's called topiramate or Topamax.
Well, Topamax is usually well tolerated, but some people do develop problems where they say they have trouble with their memory, trouble concentrating.
The second drug, Contrave, also combines 2 well-known drugs, antidepressant bupropion, also marketed as Zyban, a popular smoking cessation drug, with anti-addiction med naltrexone that blocks morphine receptors in the body. Finally, there's a newer class of drug called lorcaserin. It affects a brain chemical, serotonin, and hopes to also make you less hungry.
I'm very excited that there's a new medication potentially that will be FDA approved.
Now, the FDA will be holding a public meeting on Thursday to review the data for Qnexa, and we can expect more on the other 2 drugs by next fall.
Wow, 3 new drugs all
Yes.
at one time. There's already a fair amount of weight loss drugs out there. At least we all think that way. So what makes these different?
Well, these are actually drugs that have already been on the market for other things, and then they're combining them, putting them together, and they're trying to market them as joint combination drugs. You know, there's some concerns about this, of course, because we had other drugs in the past that have failed. We've had fen. You know, we've had some concerns about orlistat or Xenical and liver disease, and we've had, you know, other drugs that have, you know, once it got out there into the population, the general population, they started mixing it with things. We saw some effects that we didn't really anticipate.
So having said that, do you think it's still going to be kind of a wait-and-see approach once these drugs hit the market and people start using them?
I think so. Qnexa's first, and that's the one that's the Topamax with the phentermine. And phentermine used to be part of fen, if you remember that one. So, and Topamax also has a tendency to cause metabolic acidosis and acidosis in the body. So you mix that with a certain type of diet, that can increase the risk. So, you know, I'm thinking there's going to be a lot of questions that the FDA is going to ask before they let all of us, you know, use the drugs.
Yeah. Okay, I know you'll keep us up on it too.
Absolutely.
Thanks so much, Dr. Joe. Mark.